Hello, I'm Dr. Jonathan Silverberg. I'm a professor of dermatology and director of clinical research and patch testing at the George Washington University School of Medicine and Health Sciences in Washington, D.C. Flexible dosing is a very important concept to think about when managing, I would argue, not just atopic dermatitis patients, but really so many patients with different chronic inflammatory diseases. The idea has relevance in many different sort of ways. The way I like to summarize this to patients is sort of the idea that I want to give you the least amount of medicine necessary to keep you clear. And sometimes I don't even have a specific safety concern for that individual patient, but it's more of why use any medicine if you don't need to? And patients love that. They don't like the idea of us just prescribing one-size-fits-all treatments for everyone. So in the context specifically of atopic dermatitis, there's real applicability of this idea. I'll give you an example. We have some patients where they may have atopic dermatitis active for 12 months out of the year, but they may be particularly severe during the winter months in a cold weather climate, or perhaps in the summer months in more tropical climates where it's really hot and humid. And so for that patient, they may need more medicine, whether that's more topical therapy or increasing the dose of a systemic therapy during those really tough periods, but they may have an opportunity to use less medicine. In the case of oral JAK inhibitors, that might be a lower dose. In the case of biologics, that could be a more intermittent spread out dose. But the idea that they could potentially use less medicine for maintenance and prevention, but don't need quite as much to get them through that tough period. So that's one scenario where that can come up. For many patients, they may already be on a stable dose of a particular medication, and they're doing great for a long time, and out of the blue, they run into a disease exacerbation, maybe some unknown flare, maybe it's a known trigger, but they couldn't avoid it. And now they need to get through that flare, but we would also expect that they don't need to stay on a higher dose of medication for that long, get them through that hurdle, and then go right back down to the dose that was working for them for so long. So you have that opportunity, more so in the case of the oral JAK inhibitors because of how fast they work, where you've got the opportunity to say, well, we've got this little flare, let's go up on the dose, let's cool you off. Okay, flare is controlled, things are stable again, let's get you back down onto that lower dose for maintenance and prevention. So that would be another scenario where we could think about this. But there's also just an overarching consideration to think about, which is safety. And for many treatments, we see some side effects can be dose dependent. And there's a dose dependent issue where sometimes cross-sectionally or in the short term when they're taking a higher dose, they may get side effects. For some side effects, there may be issues of cumulative exposure. So there's a theoretical rationale why we would want to reduce cumulative exposure to different medications to theoretically reduce risk. And so there again, there's this opportunity, use a higher dose when you need it and a lower dose when you don't. And this is something that can work for a lot of patients. Now, I should just qualify. This doesn't work for everybody. You have to know your patients. You have to have this conversation with patients. For some patients, it can be too confusing for them. They want one dose. They can't anticipate when they're going to flare and start adjusting the dose. They get confused by that. Sometimes, even if it's the perfect option for the patient, it's hard to navigate the insurance because it might be two different prescriptions, low dose, high dose, and that's something that's not always easy to navigate in an insurance space. And then for other patients, it might be the perfect option. They are able to self-monitor, they have an insight into their own disease, they can feel a flare coming, and they can sort of anticipate and adjust the treatment along those lines. But it's certainly a very important option to consider for all patients, and then assign that approach for those where it really makes sense.